Great. Thank you so much, Brian. And likewise, we were so excited to have you be the one moderating our session today. We've enjoyed getting to know you over the years, and I'm excited to have you supporting us in this way too. So I've shared the slides with you all. Hopefully those are now easy to view. Can I get a little thumbs up from Brian and AnneMarie if they're able to see the slides? Great. Okay, so I'm Catherine LePrevost. I'm a faculty member in the Department of Applied Ecology at North Carolina State University. We're located in Raleigh, North Carolina. And I teach risk assessment for agricultural chemicals, including pesticides course. And I also teach a course in science communication. And I also do research and extension projects with community health workers related to pesticides again, but also to access to technology and to finding health information online. I'm going to turn it over to AnneMarie, and she'll be chatting with you for the next little bit.
Thanks so much. So as Catherine mentioned, I'm AnneMarie Walton, and I am at the Duke University School of Nursing as a faculty member. At Duke, I teach population health and policy to nursing graduate students, and also have a program of research. My research focuses on understanding and minimizing occupational exposures to known cancer-causing agents. And one area of focus for me is the exposure of farm workers to pesticides. And that's what we'll be talking with you about today. Can you advance for us, Catherine? Great. So during this presentation today, we will talk a little bit about a study that we conducted that was focused on washing in the field, and then some materials that we've subsequently developed to help improve hand washing, steps that we've taken to test how well those materials work, and then we'll share with you a variety of resources that you can begin to use today and share with colleagues today, and they're focused on health education materials, how to find information online, and a social media toolkit. So first, let me begin by talking about why washing is so important. And I'm sure that especially today, given the COVID-19 pandemic, folks are really thoughtful about just how important washing is. But specifically with regard to pesticides, we know that pesticides can enter the body through the skin, through breathing them in, or when one is eating or drinking, they can ingest them. And for farm workers, the most common route of exposure is through the skin and the eyes, which is what makes washing so important. In the acute term, or quickly after exposure to pesticides can cause nausea and skin rashes and some acute toxicities. And then over time, it can cause adverse reproductive outcomes or increase the risk of certain kinds of cancers. So it's really important to be thoughtful about minimizing our exposure to pesticides, and specifically washing as a way to decrease the exposure to pesticides on our skin. So you're probably familiar with the Worker Protection Standard, and the Worker Protection Standard mandates some education and training, including the messaging that farm workers should wash their hands and faces with soap and water before certain activities to minimize exposure. And those activities include before using the restroom and before eating and drinking, as well as before smoking or chewing tobacco. So here are the results of a study that we conducted in 2014 among North Carolina farm workers who were working in tobacco. And our goal was to compare what we saw in the field in terms of washing behaviors with what the farm workers told us they did. And as you can see from this slide, these farm workers significantly over-reported washing compared to what we were actually able to observe in the field. So if you look at some of these numbers, 65 out of 71 farm workers told us that they wash their hands before they eat all the time. But actually in the field, we only saw that happen 7 times, that 7 farm workers always washed their hands in the field before eating. With washing hands before drinking, 41 people told us they do that all the time, but we never saw it. With washing the face before eating, 46 people told us they did that all the time, but we never saw it. And then with washing the face before drinking, 31 people. And again, we never saw that behavior. The question always comes up, well, were there washing supplies provided? Did the growers provide soap and water to these farm workers? And the answer was not always. 2/3 of the time in this observational study, we saw that the growers provided soap and water. But if we make a new kind of pie chart to consider where in those 2/3 of the time that soap and water were provided, we only saw farm workers use that again, 2/3 of that time. So it shows this shared responsibility, both for the grower to provide the supplies, but also for the farm workers to use them when provided. So at this point, we'd love to get you to start to interact with us. Can you please use the chat box to tell us ideas that you have about how to improve hand washing in the field? And we'll read and share some of those. Live demonstrations is one suggestion, and that's a great suggestion. We'll talk a little bit more about that. Maybe you saw our slides in advance. Other thoughts? Portable hand washing stations, another really good idea. So for those of you who are familiar with the field sanitation requirement of being within a half mile of within a quarter mile of the provision of water for washing. That's not always so easy in the field. And so these portable washing stations are a great idea. Encouragement from the grower. Yep, another good suggestion. Washing breaks for everyone. We can tell you in that observational study, there were 15-minute breaks, but naturally, one in the morning and one in the afternoon. But in the heat of a North Carolina summer, you drink far more often than once in the morning and once in the afternoon. Seeing if the growers are willing to put up signs to remind the farm workers to wash the hands near where they're eating, great suggestion. And a meeting to talk about why you should wash. These are really good ideas. I think they're protocols on hand washing, how to wash. Yep. So reinforcing why we should wash and how we should wash are definitely coming through here.
Great. AnneMarie, are things coming in or should I?
I think it's okay to go ahead.
Okay, perfect. Well, thank you all for those ideas. And so AnneMarie just set the context for this work. It started in 2014 as a research study where AnneMarie was out in tobacco fields, observing what people were doing over the course of a summer and really focusing on a specific research project. And we reported back those findings to important stakeholders in North Carolina, and an important stakeholder that we recognize as our outreach worker population in the state. We realized their critical importance in providing health education to farm workers. And so the next step of this work that I'm going to share with you about takes us to a collaboration with the North Carolina Farm Worker Health Program. And I know a few of you are probably familiar with that program, but it's a program in North Carolina that provides grant and technical assistance support to sites throughout the state out to provide enabling services and medical services to farm workers. And so the work that I'm going to share with you, our collaborator was the North Carolina Farm Worker Health Program and the outreach staff who are affiliated with that program. And as an aside, this is a picture of me and AnneMarie at an East Coast Migrant Stream Forum when we were able to have those in person. Where was that one? Memphis, maybe? I can't remember, AnneMarie, but it was nice when we were all together, and we look forward to eventually being able to do that again. So the first thing that we did in starting the next phase of this work was sat down with outreach workers. We wanted to hear from them how they were currently providing hand washing education to farm workers, what materials they were using. And we shared with them those results that you all just heard, where we had much lower engagement in those washing behaviors than we had people's perceptions of how they were washing their hands. And so we wanted to hear from outreach workers what they thought the best approach would be to help increase our hand washing, and what methods they would recommend to us. And so we conducted focus groups across the state with outreach workers in 3 regions of North Carolina. And we also sent a survey to all of the outreach workers engaged in farm worker health in North Carolina. And they told us some really helpful information. They told us what types of methods and so how they wanted to provide hand washing education, and then the messages, so what they wanted to be able to tell farm workers about hand washing. And so you can see at the top of this slide the rank of the approaches or the methods, how they wanted to provide hand washing education to farm workers. And the first one was the first comment that you all put in the chat box, which was a demonstration, something hands-on. I think all of us who provide education at any level and any kind of setting, whether it's in the field or it's in a college classroom, we realize how much engage in what they're learning. So that was the number one prioritized way for people to provide hand washing education. Just below that was discussion, and then lower ranked was a brochure or a poster. And then they told us what the messages would be that would be important for us to include in any hand washing educational materials. And the top one was what to do practically when supplies weren't available. And so AnneMarie shared with you that a third of the time, farm workers didn't have access to washing supplies. And we know it's a twofold issue, that a third of the time they didn't have access to those materials. And then out of all the times they did have access, a third of the time they didn't use them. So we recognize it's a twofold issue, but we wanted to make sure that we gave outreach workers and farm workers some practical steps they could take when washing supplies weren't available. We also outreach workers wanted us to talk about how germs and pesticides were different. They thought that was important. And I think we can all appreciate, this was pre-COVID, so I think we can all appreciate that important distinction, but also how protection against pesticides goes hand in hand with protection against infectious disease. And I don't think that we appreciated to the extent we do now, even a few years ago, how important and how vulnerable farm workers are to infectious disease, and how those washing behaviors can be beneficial in multiple ways. Outreach workers wanted us to talk about the risks of not washing, and when specifically during the workday. You all talked about this, like when are the washing breaks? Like if there were washing breaks, when should those really be, to think about reducing farm workers' exposure to pesticides? And so we took all of that information from our outreach worker partners and developed this hand washing toolkit that you can see in the picture here. This is not fancy. This is going, people are doing this training in camps in the evening, at picnic tables, outside of farm worker housing. So we wanted something that was really useful, but also worked within the setting that most of our outreach workers were providing health education. And so the central piece of this toolkit is a fluorescent tracer. And so you all might be familiar with Glow Germ. That's a name brand, but others exist. And they come in different forms, these tracers. They can be in a powder form or in a liquid form, which is kind of like pesticides, come in different forms. And they're not really noticeable or visible to the naked eye. But when you shine a black light over them, then they fluoresce or they light up and they make it visible. And that makes it a really useful tool when talking about pesticides, because just like pesticides, or just like the tracer, we can't see pesticides often, or their residues with the naked eye, but they exist. And so these tracers help us think about, as workers, how working in the crop and then touching your water, or now your mask, or now your cell phone, or your clothing, how that could result in exposures to you, but also to your family members. So in addition to those hands-on fluorescent tracer activities, we have one-on-one and group discussion questions. So we heard that was an important way to support that interactive learning. So we had those included. And these materials we made, of course, in English and Spanish with learning objectives, supplies, and step-by-step instructions. And if we're going to share our contact information at the end, and we're happy to share with you these. They're not, it's nothing flashy. It's just a Word document that has these materials for you, but it's something that's easy to replicate and build on your own. And I'm also going to ask AnneMarie or someone to put in the chat a link to the PNASH fluorescent tracer manual. It's an entire manual of educational materials or educational activities that you can do with a fluorescent tracer. And some of them are more relevant to farm workers, some are more relevant to applicators, but a lot of great ideas for activities within that. Okay, the interpreter's telling me to slow down, so I'm going to do that. I got too excited, but we have a natural transition here. So thank you for that reminder. So we wanted to know how the toolkit was actually working out in the field. And so we had a couple of different approaches to this. One approach was led by our community partners. So you might remember we worked with the Farmworker Health Program in order to develop and then disseminate these materials. And so they led a survey with their outreach workers to see how they were using the toolkits and what the response had been. And we know from talking with farm workers, even in the last year, that outreach workers in the last year, they're still using these materials. They've really found them to be useful in terms of breaking the ice when they're meeting new farm worker groups, that it's a helpful activity and way to get all of the farm workers in a group engaged. So we've heard really positive feedback about these materials, which has been helpful to hear. But we also wanted to see from our perspective, we're glad from the outreach workers' perspective that it's working, that it's still useful, but we want to see from our end, did it actually reduce the residues on farm workers' hands through use of this toolkit? And does it actually result in a decrease in farm workers' pesticide exposure? Because ultimately, that's our goal, is to reduce those pesticide exposures. And so we wanted to know if we could use hand wipe sampling. And AnneMarie, as the nurse, is going to walk you through how we did this in just a second. But we wanted to know if we could use hand wipe sampling to measure pesticide residues on farm workers' hands, and that to see how washing actually reduced exposure or the amount of pesticides from pre-washing to post-washing. And so I'll hand it over to AnneMarie to tell you a little bit about how we're using sampling in order to assess whether the toolkit is working to reduce farm workers' exposures to pesticides.
Great, thank you so much. So as Catherine said, I will share with you exactly what we did in the field. And Catherine, if you don't mind advancing to the next slide, you can see a picture here at the bottom of the kind of sponges that we used. And I think Catherine has a prop as well. So you can see what these look like, but these aren't anything super special or exciting, the type that you would get at Walmart or CVS. And what we did with this was we took a syringe, so very familiar and common to nurses, and Catherine has one of those there too. These were 10 or 20 milliliter syringes, and we filled it with 10 milliliters of alcohol, rubbing alcohol. And then we took those 10 milliliters of alcohol and we wet our sponges in the field. And we asked one sponge at a time, we asked our participants to do the following. So with the very first sponge, we asked the participant to wipe their entire hand with this sponge moistened with alcohol, and then put that in the amber jar for us. We then gave them a second sponge and we asked them to wipe each finger individually and then the palm of their hand, and put that in the amber jar as well. So both of these sponges for one hand went in the amber jar for that data collection point. And then we took that amber jar to the metric lab at North Carolina State University, where it is still waiting to be analyzed. And we'll talk to you a little bit as we move through this presentation about some of our next steps. But if Catherine will advance to the next slide, we can show you our very fancy data collection station. So as may look familiar to many of you, this is the back of a van. This is not very fancy, and this is what you would expect you're trying to make in the field. You're trying to make a data collection station in the field. So anyone who has been on a tobacco field in particular, but any agricultural field in North Carolina or elsewhere can imagine that these fields are windy. Sometimes they are dusty with soil and other debris coming up from the ground. It gets very hot on some of these farms as well. And so one thing that we couldn't fully appreciate as a nurse, I've handled a lot of alcohol, but I've not handled alcohol in really high heat environment. It's very difficult to pull the alcohol up into that syringe. And it's very, very slow when it interacts with heat. We also realized that Farmworkers' time is so precious. We were doing this right before they got to eat their lunch or right at the end of the day before they went in to wash and have their own evening. And it was taking us a long time just to set up the sponges for them to be able to wipe their hands, which we were hopeful would be a quick and easy process. So once again, we want to tap into your collective brain power here, and we'll share with you this question. What can you think of that would help us to overcome these challenges that we faced in the field, as well as other challenges in hand wipe sampling? And to answer this question, what we would like to do is to break you up into small discussion groups and have you talk with each other. We're also going to ask you to fill out a Google Doc for us. And so either Catherine or Brian will drop that in the chat box for you, but it'll link you straight. If you click that, once you're in your discussion group, it'll take you straight to a 2-question sheet that you can discuss with the partners in your group. We anticipate that these conversations are going to happen predominantly in English. So if you prefer to have this conversation in Spanish, we ask that you stay here, and Zeke, our interpreter, will stay here as well and help facilitate that conversation. So thank you. And we will at this point break you into groups to again discuss how we can overcome these challenges and others that we faced with sampling in the field, because this is something that we anticipate doing again in the future.
All right. Well, welcome back, everyone. Back to the main room. We enjoyed watching your progress as you worked on the Google Doc that we had sent out. And so I've just pulled that up to share with you all in case some of you are relying on one scribe for your group. And so I'm going to just read out some of the challenges and solutions. And it was great because when we first started it, there were more solutions than there were challenges. And that's what AnneMarie and I love to see. We had plenty of challenges when we were in the field. And so love to be thinking through these solutions with all of you. So one group mentioned alcohol drying up, and so maybe finding a solvent solution that would work better, or have it all ready to distribute instead of putting it together in the field. And yes, this was one idea we had to come up with, instead of these really heavy amber jars. I don't see that on here, but after we lugged these around and did sample collection at 5 time points over the day, we were also tired of carrying these, although they're great because the amber jar, pesticides break down in sunlight. So the amber jars are nice for that, but we're looking at using conical tubes that would be lightweight, already put together, and solve that issue of putting things together in the field and having our alcohol dry up as we were putting them on the sponges. Somebody brought up the issue of time, and so suggested coordinating with the farm owner for sample collection. And that is something that we did in our little pilot study that AnneMarie was sharing with you. But we appreciate that to scale this up and to do this in the future, we're definitely going to need to have coordination or to pick a time of the day. We tried several time points when farm workers were actually on the farm and then some when they were at home. And we're just interested in looking at those to see when residues are the highest levels and see if maybe there's a way to capture people right as they're coming in the door at the end of the workday as one solution to that. Oh, great. There's another organization and time challenge solved with having a kit for every farm worker. Yes, yes, yes. I think that's an excellent solution. And yeah, this is a great suggestion to have a sample collection kit with images and simple instructions. I think this is a great solution. And AnneMarie and I have even talked about having maybe one farm worker who's the lead and collects all the samples then for the camp or that particular crew. And then another challenge someone brought up is the seasonality and the time. So that individual worker kit, maybe where they have some more autonomy over when they're collecting it, perhaps that's a solution too. Great. So thank you all for sharing these, especially that this, as we're thinking through our kits and the individual sample collection, that'll be super helpful to us. So thank you for thinking through that. So I'm going to shift back to the slides now, and hopefully you can see those. I'm going to ask AnneMarie to just give me a nod if she's able to see that now. Perfect. So we had hoped that we would have to share with you a nice overview of all the pesticides we were able to measure on farm workers' hands as a result of that study. But it's COVID, and I think we've all learned that time is different during the pandemic, and our labs are just starting to open up at NC State, but there's a backlog, and they have not analyzed our sponges yet to see what pesticides were on our farm workers' hands. But we've done just some initial method development, and we were able to find pesticides on farm workers' hands, which is what we had hoped that we would be able to find. And so we're excited to think that our method is working. And so this is an example of what we're going to see when we get our results from the lab. And you can see that this is for a fungicide, trifloxystrobin, that we could measure on our farm workers' hands from that, just our early method development. But we hope to be able to share with you in the future the exact pesticides that are on farm workers' hands and how those levels change as a result of washing. And an important thing to note that we haven't talked about so far is it was important for us to come up with a method for measuring pesticides where we could actually look at anything that would be on farm workers' hands. So we didn't want to limit it to 5 pesticides that we were looking for. We realized that farm workers are moving from field to field, from crop to crop, touching different pieces of equipment that might be used to apply different pesticides. And so we're using this untargeted analysis to see all of the pesticides that farm workers might be exposed to and might come into contact with on their hands, not just what AnneMarie and I guess, or that we think would be most likely. So that makes this a little bit more challenging, but we think it's going to make our results a lot more robust. And we're going to be excited to hopefully share those with you all soon.
So speaking of next steps, we are eagerly awaiting the complete reopening of the lab so that we can know the measurement of pesticides on the hand wipe samples that we've already collected. And then on our very last day of data collection, we started to have some of these similar ideas to you all, like, oh, this is a disaster trying to prepare these in the field. What can we do to make this easier? And so we have sort of a sub question, which is, does it do as good of a job as the traditional way of preparing the samples and the jar that we used, et cetera? So we'll have a little bit of information on that once the lab is up and running and able to analyze that for us. But then ultimately, as Catherine described it, this was sort of a little preliminary study to show that the method works. And then what we want to be able to do is to use this method to show that there are differences or to explore whether or not there are differences. Naturally, we don't know how it will work out between those who receive training and education about hand washing using the toolkit that we developed with outreach workers versus those who receive education and training about hand washing some other way, if at all. And so we want to be able to compare those two groups and see if there's a difference in pesticide residues on hands. And that's how we intend to use this method moving forward.
Great, thanks, AnneMarie. And we just want to end with some resources that we've been a part of developing that we hope will be useful to you right now. We know that the season ahead is, at least for many, going to look different than maybe more similar to last season than we hope, but different from our typical season. And we put together some resources that we hope will be useful to you all as you start this next growing season. And so when I introduced myself, I mentioned that part of my work is around outreach workers and technology and health information online. And so I want to share this Farmworker Health Literacy website with you. And this is a resource that we developed with partners at East Carolina University, and it was funded by the National Library of Medicine. And this has resources, and I think it might be .org instead of .com. I don't know if both get you there, but AnneMarie, maybe you can fix that for me quickly. Thank you. And so I want to direct you all to the For Outreach Workers tab, where I think there'll be a lot of resources that will be helpful to you all. And so the first thing, if you go to that website and the For Outreach Workers tab, at the very top of the page is a link to a list of hundreds of patient educational materials that you could use with farm workers, or that outreach workers could use with farm workers. And so in talking with outreach workers about this, about resources, we've heard over and over that they can't use the same thing season after season, that farm workers get bored of seeing things presented the same way. And so it's important to keep things fresh. And so hopefully this resource will help you be able to find lots of patient educational materials. Some of them you might not be familiar with, that you can use to keep your education for farm workers exciting and novel. And these materials are arranged by topic. Also under that For Outreach Workers tab, so just below those patient education materials are 4 different YouTube videos. And these are designed for outreach workers to help them find health information online. The first one helps provide a little bit of information about how to evaluate health information using something called the CRAP test. So easy to remember, but is that information online reliable and trustworthy and something that you want to share with farm worker patients? The second video relates to free consumer health resources. And even as someone who does a lot of research, I know that when I have a health concern and I'm going to Dr. Google, I'm tempted to use some websites. And this video is really helpful, even personally, but also as you're finding professional resources. What are some of those good, reliable consumer resources? And then what are some that we might want to avoid because of how they're funded or who writes the material that's on them? Videos 3 and 4 help you find more specific types of health information. Video 4, I think, is super helpful. PubMed is a repository of farm worker health research and lots of other health research. It's a free website. You can access a lot of materials open access that way, or papers, research papers open access that way. But it's kind of intimidating to get started using. And so this is a really great video to help you just become a little more comfortable searching for information on PubMed. And then finally, let me scoot back here. So I've been telling you what's under that For Outreach Workers tab, but under this Digital Inclusion tab are 4 more videos. And I should just say that all of these are in English and Spanish. And those 4 videos for digital inclusion are really for farm workers that are found on that second tab. And they focus on how farm workers can avoid being scammed through phishing. It also has an introduction to telemedicine appointments, which I think we can all appreciate are going to be important this coming season, but in the future as well. So there are some great resources that you all might be able to use for outreach with outreach worker, as an outreach worker, or as a farm worker. So those are all there on that website. And then I want to share quickly with you a second resource that is going to be available next week. So this is a bit of a teaser. These are as a social media campaign, all related to pesticide protective behavior. So fits in really nicely with what we've just been talking about. These are resources developed by the Pesticide Educational Resources Collaborative, which is a cooperative agreement with the EPA. I serve on the advisory board. And so it's a toolkit that has all of the materials that you might need for Facebook, Instagram, Twitter campaign related to pesticide protective behaviors, and really focuses on those worker protective standard messages that you've heard about in this session, but in other sessions over the conference. And so they're not quite ready yet. We're putting the finishing touches on them right now, but you can use this short link at the top of the page here to get on the notification list for when these materials are available. You can sign up today to hear about when they launch next week, but you can also access them on that pesticideresources.org page. And you can, there are 17 different images, and so you can post one or more per day. And we're really encouraging people to collect information from farm workers about their pesticide exposures and the things that they do to minimize those exposures. And so what I'm showing on the screen is just a taste of what some of those final social media materials will look like. And so with that, we'll just open up for the last 5 minutes or so that we have to answer any questions that you all might have. We also have our email addresses here, and we can leave those on the screen to just see if you have questions for us, not now, but in the future. We're happy to be a resource to you all as we're able.
And just really quick, while people are gathering their thoughts, maybe to drop questions into the chat, I just want to take a minute just to put a link into the chat for our evaluation. We just we'll post the evaluation survey for this session. So, you know, if you're thinking of a question, or you're on your way out possibly, please take a minute just to complete the evaluation. It'd be really, really helpful to get your feedback. So thank you very much.
I'm going to stop sharing the slides, and I think we can drop our email addresses into the chat box, but then happy to answer any questions you all have.
How about we just give a virtual round of applause to our speakers, Catherine Elizabeth LePrevost and AnneMarie Walton at the same time. Thank you guys so much for the presentation. I just want to say as well, thank you, everyone. A big thank you for supporting the amazing work that you've done and attending this conference. It's brought, you know, together over 1,000 individuals throughout the country. I also want to just give a special thanks to our interpreters, and of course you all. If it wasn't for you all, then this wouldn't exist. I mean, I think it goes without saying, thank you as well to the farm workers and those that have participated in these studies, and as well just work for the survival of this country. So thank you so much.
Those are great points. I see one question in the chat that I'm happy to answer, and that's about how long we spent observing farm workers in the field. And so the answer to that is that for each of the 71 farm workers who participated in the study, I spent one full shift with them. And as you can appreciate, in farm work that looks, in agricultural work that looks different for everybody. So some days the weather cut us short and I was only with them for 4 hours. I think the longest shift that a farm worker worked while I was observing was about 13 hours. And so I tried to get to the farm around between 4 and 5 a.m. and was there when they began, and then stayed for as long as their day was. I began in May and finished in September. of that season. So it just took a while to observe everyone and then come back and do some individual interviewing on the weekends where they lived. But it was only one shift, so it may not be representative of their practices all the time. But certainly the duration of that day with them over a series of months on 3 farms.
And we should say that we didn't tell people that we were looking at hand washing specifically. So we tried to do some things to minimize a deviation in practice, but I think we can appreciate that having someone watch us work potentially changes what we're doing.
So what they knew with the IRB's permission, the Institutional Review Board permission, is simply that I'm a nurse and that I'm interested in how people keep themselves safe at work. So they didn't know whether I was observing like their body mechanics when they were in the field or their washing behaviors or what they were wearing. They just simply knew that I was a nurse interested in safety and I'd be with them with their permission for that day.
Well, thank you all so much. And thank you, Brian, for pointing out our thanks to all the farm workers who participated. And this work really could not happen without our outreach worker collaborators. They've been so important in driving this work and informing it every step of the way.